Stats in a Wrap, the podcast series from Eurostat. Today, we'll be showing how the EU is collaborating with the WHO and the OECD to grapple with the stats on healthcare workers.
1 in 3 doctors and nurses express symptoms of depression.
The data shows very clearly that becoming a doctor is still an attractive career option.
We also have data on physicians and nurses.
Hello and welcome to Stats in a Wrap, the podcast all about statistics from Eurostat. Today's episode is all about the healthcare workers who keep Europe's health systems on their feet and the data that is revealing a crisis threatening us all. Europe has more doctors and nurses per head of population than anywhere else on Earth, and yet across the continent, health systems are under strain, overwhelmed, understaffed, and increasingly anxious about the future. The numbers behind that paradox are striking. Nearly 1 million health worker posts across Europe could be unfilled by 2030. The population is ageing faster than at any point in recorded history, and the next generation of young people that might care for our elderly is increasingly drawn to careers in technology, not nursing. In this episode, we dig into what the data actually tells us about Europe's healthcare workforce, where the pressure points are, where the trends are heading, and what the numbers reveal that the headlines so often miss. Guiding us through the numbers in the Wrap Cafe today are 3 people who spend their professional lives inside this data, and it's my pleasure to welcome Tomas Zapata. Tomas leads the Health Workforce and Service Delivery Unit at the World Health Organization's Regional Office for Europe. Tomas, it's a great pleasure to have you on the show today. Thank you for joining us.
Thank you, Jonathan. A great pleasure to be here.
Lovely. And joining Tomas is Monica Pace. Monica is a statistical officer at Eurostat, where she works specifically on health non-expenditure statistics, and we'll be finding out what that means a little bit later. Monica, it's wonderful to have you on the show today.
Thank you, Jonathan. It's great to be here today.
Lovely to have you here too, Monica. Yeah, and last but not least, we introduce Katarzyna Ptak-Bufkens. Katarzyna is a policy officer at DG SANTE, the European Commission's Directorate General for Health and Food Safety. Katarzyna, welcome to the podcast.
Thank you, Jonathan. It's great to be here.
Thomas, let's start with the big picture. The data shows Europe has more health workers than ever, and yet health systems are under real strain. What's actually driving that apparent contradiction, and how serious is the workforce shortage looking ahead?
What the data is showing us is that there is a health workforce crisis in the European region. We have around 940,000 shortage of health workers by 2030 in the European region. And what is striking is that we have more health and care workers than ever in the European region. And actually, WHO's European region is the region with the highest density of health work in the world. So the question is why we are having shortages. The reason is because what we are seeing is that there has been a rapid increase of the demand for services that has outpaced the increase of the supply of health workers. And the increase of the demand for health services is due mainly to the aging of the population. That's one of the key factors, but also because there has been an increase in chronic conditions, in multimorbidity and complex conditions. So all this really makes that the workload of health workers is increasing, while on the supply side, what we see is an aging workforce. On average, 30% of the doctors are older than 55 years of age, but we also see, for example, an increase of migration of health workers to other countries, and we also see an increase of burnout and mental health problems of health workers.
Monica, this collaboration spans Eurostat, the WHO and the OECD, and it covers 60 countries across a very broad European region. What does working across those 3 organisations actually give you that none of them could achieve alone?
I would like to say that this is a very, very interesting experience, working very well. We are very satisfied with this collaboration. Of course, the coverage of the data is different from the WHO perspective. They cover the WHO European region. Eurostat is collecting and disseminating data about the EU. The collaboration itself is going on since several years with the OECD and WHO European region. It has multiple advantages for all the involved parties. The statistical data are consolidated across international partners, the definition of variables. And what we really are interested in collecting is a result of in-depth discussion and consolidated agreement.
Why nurses are understaffed, doctors are having too many work. I work myself in a hospital, so I can speak out of person that it's a crisis.
Yes, it's a major healthcare crisis everywhere in Europe.
Well, speaking from like a Finnish perspective, I think the healthcare system is in a bit of a crisis. I think because the economic state is a bit fragile at the moment. I think healthcare is paying at least some of the price of that. So,
Thomas, in 2024, for the first time ever, there were more people over 65 in Europe than under 15. What does that milestone actually mean for health systems, both in terms of the care that will be needed and the workforce available to provide it?
What we see, as you are saying, population over 65 will keep growing and the population under 15 will keep decreasing. And when we look at the projections, I think it's important just to give a figure so that people understand this better. So population over 65 is projected to double between 2010 and 2050. And population over 80 years of age is projected to multiply by 3 in the same time period. So imagine the consequences for the health system. But before that, what I would like to say is that this is a big success. And as the European Union, we have to congratulate ourselves. Having said that, what we see, of course, is that there is an increase of aging. And we know that the population over 65, 1 in 10 will require long-term care services. The population over 80, 1 in 3 people will require long-term care services. So that means that the pressure on the health system is already increasing and will keep increasing. We'll have more chronic conditions, more multimorbidity, and more complex patients that will require more integrated and coordinated care. So in that sense, needs are changing of the population, and the health system should also change and adapt to those changing needs.
When you mentioned ICT there, let's just clarify that means information communication and technology, basically the tech sector. Katarzyna, what does the data look like from DG SANTE's vantage point? You're watching those age brackets shift in real time across countries. What patterns stand out to you?
People who are age 65, we see very clearly that life expectancy exceeds 20 years. But what is also clear that more than half of these years are lived with some kind of disability or chronic illness. That's why I think that we need to step up preventive efforts. And actually, we did a little simulation through the health workforce planning model. According to the simulation, we face 2 scenarios. So we may see a need to increase the health workforce size if these patterns continue. But we may also do better if we improve the preventive efforts in Europe. So we may need less health workforce in 2070 if we manage to step up the prevention. So clearly we need to adapt our health systems, and that really requires rethinking how healthcare is delivered.
I know a few people that do medicine. They are really passionate about helping others. Myself, so I studied biochemistry. I like more like the research part, but I think I could have also done medicine.
So I love my job. I love to take care of people. I love it when they are getting better by the treatments we give. So yeah, we'll choose it again.
For me, working in healthcare wouldn't be an option, I would say, because it's not something I'm somehow connected to or interested.
Katarzyna, when you look at the data on career intentions among young people, the 15-year-olds who will be tomorrow's health workforce, what are you seeing? Is healthcare still an attractive destination, or are we losing them to other fields?
The data shows very clearly that becoming a doctor is still quite an attractive career option. But unfortunately, people who are 15-year-old become less interested in pursuing the career of a nurse. So this is indeed a big concern for Europe, because if we want to enhance the new models of care, step up preventive efforts, we may need to rely more on nurses. We saw after the pandemic the decrease in interest in pursuing the nursing careers in at least half of the EU member states. It's also true that the health sector and the ICT sector, they compete for a different pool of talent. The health sector attracts people who tend to look for societal value, and ICT clearly attracts more people who like innovations. So clearly there is a difference in the motivation.
We also have data on graduates, both physicians and nurses. The trends indeed are showing a slight increase in the last few years, very, very slight increases in absolute numbers, let's say. If we don't register a substantial increase in numbers in headcounts of graduates, we will face a worsening of the shortage situation.
Thomas, you want to come in here?
What I would like to contribute is that I think the immediate important action at the moment is improving the working conditions to improve the retention and attraction of health workers, as Kasia was saying, because what we are seeing is that some health workers are leaving the health profession, and every single loss is a big loss because there's a lot of experience, there's a lot of training invested. So that's we really need to take that seriously.
Monica, you're at the heart of something called the Joint Questionnaire, a phrase that sounds very dry, but turns out to be actually a very powerful tool for statistical analysis. What is it, and why does it remain so central to how we understand health workforces across Europe?
The Joint Questionnaire is a tool to produce statistics of good quality using shared concepts and definitions of the same variables that have been agreed among all the involved parties. The Joint Questionnaire addresses the main structural elements of the healthcare provisions, such as the healthcare workforce, the hospital capability of providing care by counting, for instance, the available beds, the day of permanence in hospital, the main diagnosis at discharge, and so on. The data collection is based on administrative data, meaning that the information is collected based on existing registers or other administrative sources. For instance, in the case of workforce migration, the main sources are professional registers or the working permits delivered to immigrants.
Thomas, you mentioned burnout earlier. There are now major surveys studying this specifically in healthcare workers. Can you tell us what they're finding and why keeping the statistical frameworks up to date with something as complex and fast-moving as workforce well-being matters so much?
You're right, Jonathan. I think this is a very important topic, and it's interesting because before the COVID pandemic, very few people were talking about mental health and well-being of health workers. We all know to all the stress and the pressure that health workers were under during the COVID pandemic. We got funding from the European Commission, and we worked together on developing a survey on mental health of nurses and doctors. We call it MEND survey. And we passed the survey in all 27 European Union countries, plus Norway and Iceland. And actually has been the largest ever survey conducted on mental health and well-being of nurses and doctors, because we got more than 220,000 responses from these countries. And what we saw is concerning. 1 in 3 doctors and nurses express symptoms of depression in the last year when the survey was conducted. 1 in 3. That means that the prevalence is 5 times higher than the general population. When we look at anxiety, 1 in 4 doctors and nurses had symptoms of anxiety. 10% had suicidal ideation. 10%. So we really need to take this seriously. And interestingly, the young doctors and nurses had worse indicators of mental health than the older doctors and nurses. So you see, we were talking before about attracting the new generations, making it attractive. So we need to take this seriously. And then in terms of the risk factors, what we saw, violence against health workers. 1 in 3 doctors and nurses were exposed to bullying or violent threats. 10% reported physical violence. 10%. When we look at working hours, 1 in 4 doctors work more than 50 hours per week, which is beyond the 48 hours per week directive for working conditions in the European Union.
Katarzyna, we know the standard administrative data well, but are there complementary approaches, qualitative methods or experimental statistics, new ways of listening to the workforce itself perhaps, that could give us a richer picture of what's really going on?
Absolutely. We need to innovate the way we actually capture our human resources in health systems to really understand the health workforce we have and the challenges they face. We need to know more. It's not only about estimating the shortage. We need to know much more about the distribution of health workers, composition of the health workforce, patterns of their participation, but also we need a more nuanced evidence on their motivation, on actually factors which influence their career pathway. So their mobility within the sector, but also the mobility outside the sector. We have the evidence which confirms that many of them are quitting their jobs. We need to know more if this is temporary and why they are quitting. This is actually very important. Without knowing it, we cannot really propose robust policies which will address the underlying factors. That's why I think that a mix of methods, above administrative data, but more qualitative data, should not be seen as a problem. It's actually an opportunity for us.
Too many doctors and too many hospitals in some areas and not enough in other areas. Yeah, if you go on the countryside, you don't have enough. If you go in the big cities, you have too many hospitals. Expenses are going up. Yeah, with this uncontrolled, scattered health system which you have, and that's a problem. Yeah.
So I think they just try to delay things, like they worsen them and worsen them and worsen them. But then, yet they still have to put up like a lot of investments into it. Like just try to go into preventative medicine or something.
More money needs to be invested in healthcare in order to have like maybe more hospitals, more doctors, nurses, so we can attend everyone.
Thomas, let's just go back to this paradox that's at the heart of all of this. Europe has the highest density of health workers anywhere in the world, and yet the system still feels stretched. What does that tell us? And is Europe effectively an early warning for what other ageing regions in the world will be facing?
Comparing ourselves with other regions, I think we are in the front line in the sense of experiencing this aging of the population, because we are the region with the oldest population in the world. So that's really stretching our systems. So that means that we are a little bit ahead of other regions in terms of trying to find solutions to these challenges that we are experiencing as a region. We need to rethink the models of care. We need to optimize the health workforce, how we can really maximize the limited number of health workers that we have so that they can really address that increasing demand that we were mentioning before. And in that sense, we need to rethink how we reorganize services, how we better integrate services, how we define the teamwork and the skill mix, and how we bring digital and artificial intelligence.
Monica, cross-border flows of health professionals are increasing across Europe. Is that trend better understood as healthy, sustainable mobility, or is it closer to a destabilizing brain drain? What does the Eurostat data show?
The figures show a slight increase in the inflow from foreign-educated doctors and nurses in most of the countries, and the numbers are on the rise. Literally, European countries are receiving doctors and nurses from neighborhood countries and also exchanging those two professional categories among them. The reason of the migratory flow could be linked to linguistic easiness for countries sharing the same language. Of course, the element of better working condition is a huge attractiveness for those professional categories. And the geographical proximity can also be one element. We have data according to the countries of origin for those migratory flows, but we currently do not disseminate this data. We disseminate the total number of doctors and nurses migrated to the reporting countries.
Thomas, the WHO's own report found that the number of migrant doctors in Europe rose by 58% and migrant nurses by 67% over the past decade. Can you just unpack those figures for us? Where are these health professionals coming from and where are they going?
Yeah, no, in the report we use data from the Joint Data Collection Questionnaire. What we see is an increase in the last 10 years of migration. Interestingly, when we look at doctors, what we see is that 60% of foreign trained doctors are coming from outside the European region. But interestingly, that 60% is recruited mainly by 5 countries: the UK, Spain, Germany, Ireland, and France. So those 5 countries are the ones really attracting and recruiting foreign trained doctors from outside the European region. What happened to the other 40% within the European region? Those doctors are mainly coming from the eastern part of the region to the western and the northern part of the European region. So that's a bit of the flows for doctors. And for nurses, what we see is that 72% of the nurses were trained outside the European region, and they were recruited mainly in 3 main countries: the UK, Germany, and Ireland.
Katarzyna, let's just talk about the Joint Action Heroes initiative here, launched in 2023, an ambitious effort to improve health workforce planning across member states. Just tell us a bit about what it's trying to achieve, and if it achieves its goals, what would that really look like?
Thank you for that question, because this is really one of our flagship initiatives through which we want to help member states to address the health workforce challenges. And this specific one is actually helping member states to improve the way they forecast the need for their health workforce. And one of the core work packages in this initiative helps member states to improve the robust data for health workforce planning. Heroes sparked a fresh way of thinking about the data used for health workforce planning, and member states actually go beyond the simple headcount. So they use a lot of full-time equivalent data, so they improve their data registers. Another big achievement, I think, is that this initiative also helped to move beyond just estimating the size, the supply of the health workforce. We saw in the past that many countries use supply-based models. This is why we need to think more about the demand for health workers, and this actually defines the resources we need.
Monica, we've spent a lot of time here talking about what the data shows. Let's end on what it doesn't show. If you could point to one blind spot, something happening in the real world that the current stats simply aren't capturing, what would it be?
I would like to stress the importance of data on primary care and the current development of the long-term care statistics that Eurostat is currently working on. I would like also to better capture the increased professionalisms of nurses, with more tasks being delegated to them, to better depict the activities they are involved in. I would also love to have more granularity of data to address inequalities in accessing care in the so-called medical desert, where there is a lack of offer and difficulties in accessing care for many people.
Katarzyna, same question to you. What's on your wish list? Where are the gaps in what we currently measure that you'd most want to see filled?
I think that, we need better data to capture and understand the care organization, how it is changing, how it is evolving. So indeed, shifting care to primary care, stepping up prevention, this is really of core importance. And that, of course, impacts on the health workforce. That implies task shifting, changing roles, and we still don't know enough about it. So this is important.
Tomas, you've heard Monica and Katarzyna's wish lists. What would you add? What does the data still not capture that you think matters most?
They both mentioned most of them. I just want to highlight the importance of the care workforce. We have an aging population and the care workforce is a big gap that we have at the moment, so I will put the emphasis there.
Fantastic. That was very succinct and very kind of you to help us round off the questions there. It only remains for me to say thank you very much to all of you for your amazingly insightful and generous thoughts here in this very stimulating podcast. Vast topic, probably deserves more than one podcast. So many areas to cover, so many countries and so diverse and a real sense of crisis and need here that is desperate for data. We need more data and we need more podcasts about data, but we're out of time. I want to say a genuine thank you to all three of you. But first of all, I'm going to say to Tomas, thank you very much. The global perspective you brought today has been invaluable.
Thank you so much, Jonathan. It's been a great pleasure to be here. Thank you.
Monica, I also want to thank you. I think our listeners will now have a much clearer sense of just how much work goes into building the data set that dozens of countries can actually agree on and use. So thank you very much for your contribution today. Monica.
Thank you, Jonathan. It's been my pleasure being here today.
And Katarzyna, thank you so much for your contribution today. It's been really stimulating. Thank you.
Thank you, Jonathan. It's been great to be here.
Wonderful. Well, that's all we have time for today. If you've enjoyed Stats in a Wrap, don't forget to follow us on the streaming platforms where the show can be found on Spotify, Apple and YouTube, and share our adventures with family, friends and colleagues. And if you'd like to know more about the topics covered in this podcast and practically every aspect of statistics in the EU, you should make your way to Eurostat's amazing educational resource, Statistics Explained. And of course, come to the Wrap Cafe for the next edition, in which we'll be finding out about the incredible data detective story surrounding Europe's farms and how the stats reveal that Europe lost 5 million of them in 15 years. Join us then. But for now, goodbye.